So how many in the room have ever heard or met Dr. Richard Grady? All right. So Dr. Richard Grady happened to be my daughter's doctor when she came home from China. And he's really the gentleman that got me into working with the ABC. I became very close friends with him during the 5 weeks that Anna was in the hospital recovering. And during that time, I learned about all of the humanitarian work that he had done in the Gaza Strip and in India. He really worked with Dr. Asim Shukla and that whole team, and was the one that was really instrumental in me getting involved in the global aspect of bladder exstrophy. Dr. Grady tragically passed away several years ago with brain cancer, and I always felt that I would honor him by making it my life's mission to carry on his work. And through that time, I've met a lot of other physicians who are also humanitarians who have been committed throughout their career and are carrying on his work as well. So I feel that this is a very heartfelt award for me because it is a humanitarian award for people who, and again in Dr. Grady's honor, who have really exemplified the highest value of leadership and excellence in clinical care and research, innovation, teaching, volunteerism, advocacy, and dedication to improving the health of those living with bladder exstrophy around the world. So I couldn't think of a better person to honor this year than Dr. Pippi Salle. And I usually like to surprise my award recipients, but it was really hard to get him here without telling him why. So we're going to do a bit of a different format today. But for those of you that haven't had the opportunity to meet Dr. Salle yet, he pretty much lights up a room, and once you've met him and talked to him, you never forget him. I've always been impressed with his innovative surgical techniques and the things that he has taught. He's published over 180 papers in peer-reviewed journals and has also written over 55 book chapters. And he is only 39, so you've been very busy. I'm going to give him some barbs. He's been a visiting professor in over 40 countries. I don't know how, do you ever stay home? Every time I talk to him, he's somewhere else. He's edited the textbook in clinical pediatric urology, which is one of the most prestigious in the specialty. And he's trained many of the world's leading pediatric urologists. He also received the Lifetime Achievement Award in 2019 of the World Federation of Pediatric Surgeons in recognition of his academic contributions to the pediatric urology worldwide. He's been a longtime ABC advisory board member and a true humanitarian. Now, the Dr. Salle I've gotten to know has been really in a lot of different countries around the world, working with a lot of different families from a lot of countries. But the thing that always struck me is the time, I think we went to India for the first time together. It was both of our first times when we went to India, and I think we've gone, what, nine years now? Something like that. It's been a long time. But he does light up a room when he comes in, and the young fellows love to follow him around. He's quite busy when he's doing surgeries in India because he does have followers. A lot of the young fellows affectionately call him the guru. And the poor guy works from morning till night because not only is he doing some of the most complex surgeries there, everybody wants to sit with him at dinner so they can talk about the cases of the day. So it's needless to say, he works very hard when he is in India working for Dr. Shukla. But the thing that strikes me a lot, I'm not in the OR, I'm out on the ward. And Dr. Salle has always, anytime I've ever needed to consult with families or children, I could always go into the OR, ask for him. He would come out and help me talk to a family about what their surgical treatment plan was going to be. He never would turn me down. He would always come out and help me talk with families. One of the times I do remember is we were working with a family that you were going to do an augment on, and we had the teaching doll, and we were trying to show them what an augment was going to look like and the X-fixes. And it's a busy time in India, and so Dr. Shukla's got research rooms going, we've got nursing rooms going, we've got pre-scheduled nurses going. We had nowhere to talk to this family. So Dr. Salle and I ended up in a broom closet. Do you remember that? We were in a broom closet teaching this family about what their surgical plan was going to be. So you never turn me down anytime I ever ask for your help, and the families love you as much as I do. During one of our trips to India, I got an email in the middle of the night from a gentleman in Pakistan who had spent 2 years of his life looking for care for his little, then 4-year-old daughter, Kosh. And everyone kept turning him down. And I was reading that email in the surgical room, and Dr. Salle said, well, he's from Pakistan. Why don't you bring him to Doha? I'll take care of her. I said, you do that? So I quickly emailed the father back, and I said, I think I've got a surgeon that'll treat your daughter. And a few months later, Kosh and her father traveled to Doha, and that became the first international patient that I sponsored to bring to another doctor. So, and every year when I go through Dubai, I meet with that family, and I've watched that little girl grow up into a beautiful young teenager, and she's doing very well. And during that time, that opened the door for us, where Dr. Salle told me that with the opening of Cedar Hospital, that you would be willing to do some other humanitarian work, and actually got me in touch with the Qatar Foundation and secured a meeting with one of the vice presidents because you treated her son, and so that opened the door. And the Qatar Foundation actually sponsored a couple more children for us and did a documentary on Dr. Salle's work at Cedra. And 2 of those patients here, one is Samir, who we did see at the first time in India, but he had such a large hernia and bowel obstruction that they needed to do a first surgery first, and then we brought him to Doha for his main closure. And then the second patient who's near and dear to my heart is Annette, who came from Ghana. Now that was a complicated one because the plane, she landed in Burkina Faso, and they wouldn't let her travel through. And it's like 2 o'clock in the morning, she's calling me. She says, they won't let me on the plane. So Pippi goes, let me call the Qatar Foundation, because she was flying on Qatar Air. And lo and behold, 2 hours later, she's on a plane to Doha to have surgery, because we had the Algiers TV doing a documentary on your work that day. So we really needed the patient there, and you were upset because you're going, she's going to show up with a fever and an infection if she's sleeping on the floor. So I told the mother, just leave your luggage, just get on the plane. He's waiting for you. Surgery's going to happen in several hours. So Annette stayed in the hospital for about a month, and I was there for the first week. And Dr. Salle invited me and the reporter over to his house for dinner, and I showed up with a bag of laundry. I said, Annette and her mother have no clothes, and I have nowhere to do her laundry. And Pippi said, Pam, I'll do any surgery you want, but I really draw the line when it comes to doing the patient's laundry. That really shows. I mean, he really does go above and beyond. And he did let me do her laundry. He's also followed Solomon from the time that he was a little baby to a time in India, and now Solomon's back at Sick Kids with Dr. Salle. And so he really does truly have touched a lot of patients' hearts from around the world. This is where I tell on him. We not only work in India, but we do have some fun. I tried to get a hold of some Bad Dog here, but I don't think they sell it in the United States.
Wild dog? This is the wild dog?
The whiskey?
Oh, yeah.
Yeah, we get in a little trouble in India, but we do have some fun. We do have the opportunity. Dr. Shukla gives us time to visit the Gandhi, and we would go to kite festivals, and you even treated me like a princess at the fountains that day. So really, it's really fun when you get to travel with these doctors, and you not only see that they're amazing surgeons, but they're also amazing human beings that really do care for our families and our children. So it's a really great honor to give you this award, Pippi. And I'm going to ask you a couple of interview questions so everyone else can get to know you.
Well,
and then at the end, you can
after
ask
so beautiful words.
To hug you. Thank you.
I don't know if I deserve all that, but it's nice to hear.
Well, this was very well deserved. So here's the first question I have for you. So tell us about your early career in urology and why you decided to specialize in exstrophy.
Wow. In exstrophy, I never forget. When I did my fellowship training in the States, when I was in 1982, I finished after 4 years. And I went back to Brazil, where I come from. And in my city, as soon as they heard that there was a doctor that was trained in the States, they start sending me all the exstrophies because nobody wanted to operate on them. And I myself did not have training either, because during the time that I was in my training in general pediatric surgery, I didn't have enough experience. And it gives me always a lot of anxiety when I don't know what to do. And I was feeling that tremendous anxiety. I don't want to learn myself directly without any supervision. So I managed to get some support for 2 patients from the public hospital and took them to São Paulo, where they had a service where they are doing exstrophies, referral from Brazil. And then I said, I want to refer 2 patients. And he says, okay, you can send them, we'll take care for you. No, I want to go with you. I go with them. So we travel together, and I follow them doing the exstrophy cases. And I learned many things at that point. And some of the things I still teach today, the way that when you don't have orthopedic situations still help me when I go to a bad case, that I have those maneuvers that I learned in those days. And that instigated me to try to take better care, because there are so many patients with so many complications. That was difficult. I think I suffer with the family as much as they do. And it's very difficult for us. We all know we want to help, but sometimes not possible to do the help and to get the outcomes that we would like. And we all have. And so I decided to every time get more involved. And at the end, I was getting all the extrophies in my province. Then I went to Canada. And in Canada again, we start showing interest. And people, fortunately, I think, when they see that you are interested and really genuinely interested to help families, and they start referring patients to us. Like the same thing I said in my back here. You're so lucky to have this collaborative study group. And they start coming. And I start building experience. Then I start being invited outside. And every trip I go for visiting professor, I have always an exstrophy, an epispadias. And this, I learn a lot. And I start trying to do some modifications in here and there, taking my own opinion. And today I think we do many things that are, I hope, accepted by many of my colleagues. We discuss. We don't have the state of the art for exstrophy yet, but we are much better than about 20 years ago. I'm sure of that. So that was my itinerary in exstrophy. And I find that Should I continue?
Yeah, sure.
Or do you have another question?
Well, I have lots of questions. Go ahead.
I find that the first thing I say when I get a patient with extrophy, I tell the family, we are going to be friends for a long time. We're going to be together for a long time. We better get along well, openly, transparently. We are going to start. You can ask any question you want. And I said, we're going to have probably 3 main phases in the treatment, especially boys, especially. Let's make boys and girls too, but boys too. In the first stage, what we need is we're crazy to close that defect that's there, that's so apparent and so, so difficult to change every day. So we have to close. Once we close that, then comes the second question. Boys need to have the genitalia corrected as a second stage. The third stage, now everything is going well, is about the continence. So we have to work with the continence, which is the third stage. And then everything goes smooth. We still have another phase, which is then during adolescence, when they come then with all the conflicts of adolescence, sexuality, and this does not finish. Then you have later on, again, my patients, I'm old enough to have all these levels. They come about fertility. I want to have a baby. I want to see. And the boys want to have problems because the genitalia is not adequate for sexual intercourse. Then I sit with them. I teach them, listen, guys, you have to do this, and that. Ask your father. The father doesn't say anything. Talk to me. We'll talk about it. I don't have no hesitation to talk. And then comes, and I old enough that I have 2 girls now that were pregnant, and I went to the labor. And I was there, and I got one of the babies and took a picture with her. So it's stages that I was happy enough to go along. And that's why the families, my extrophy family, I almost like my family. I feel like one of you sitting here because it's part of it. We go together in this journey, and it's not easy. But if you are together, I think it's easier, not easy. We have also. That was my itinerary,
Good.
my way.
Thank you.
I don't know if everybody agrees with that, the itinerary that I think it's pretty much. The older patients probably can tell. No? We go one step by step. And yeah.
Yeah. So out of all the countries you've been visiting, Professor, where do you feel like you've made the most impact?
I think, it's very little to make an impact in America, to make a huge impact in Canada, because the guys are so good already that it's difficult to make them much better. But I think the place that I changed completely was Kazakhstan. Kazakhstan, there was no pediatric urology, nothing. And I saw those kids, and so I went there, and we did several cases together. But not only did the case, I instigated the surgeons to learn. You need to learn. I said, it's not like giving fish. You need to learn how to fish. So they came to Qatar. They came to following us in India now, and they are doing a much better work. Today they have a division of pediatric urology in Kazakhstan, and they are doing a great job. I think Kazakhstan was pretty much Morocco also. Countries that are not as developed, I think we make the biggest impact.
Good. So you've trained many of the world's leading urologists. Tell us what you think is important for a new urologist to know about extrophy.
Empathy. I think the most important thing is to have empathy, to connect with the families, with the patients. It's easier. I cannot just think about technically. You need more than that. You need to be interested or genuinely interested to help these families on these difficult problems. I think also I try to make them understand that Although we are doing much better, there is a long way to go still to learn new things. We still don't have, my opinion at least, I don't think we have the ideal treatment for extrophy. We still many things, many issues that we need to continue working on it. So I try to instigate to get interested and try to think about, try to look at the problem that we have as an opportunity for them to learn, to grow professionally, and maybe to create new approaches that can help us. So I think that's one thing. But also, I find that an extrophy patient is the ideal patient. And now I'm going to do only technically. I hope you don't matter, don't get upset with what I'm going to say. But it's the best teaching individual that you can have, because you have to teach about surgery for the bladder, reimplantation, genital surgery, all types, curvature, augmentation, umbilicoplasty. You go from the whole scenario of pediatric urology to one patient. You should be all-rounded to take care of extrophy. It's not enough just to know how to do well an epispage. No, you need is a universe of problems. So I think that's what I tell also my fellows. Listen, be here with the patients with extrophy. That there's a lot of things that you learn on this particular patient.
That's good. Yeah.
I don't know that
You've told me that
you all
before.
agree, but
You may have touched on this, but if you could expound a little bit, you have built lifelong relationships with your patients. What do you feel is important when you're putting together a plan of care for them?
what I think everything, so many things are important. I think I heard the girls here talking before, and I was really touched with that because that's true. No, we need to communicate, be able to talk to them, clarify what's the plan, and where are we going from here, transparently, and not with false hopes and things. Telling you, we need to face this challenge now, and I think that's. I think the main thing is to be able to dialogue clearly both with the parents and the patient too. My adolescent patients, I think I have such a great pleasure. Sometimes I wish my son talked to me like I talk to my patients. Sometimes more difficult for you to talk to your own son than with a patient. And so I follow them. Their things. I have the pleasure of having now 3 patients that, because they had extrophy, we managed to bring them to Canada as a refugee, and they changed their lives completely. And that's a huge pleasure for me, to be that I changed the life of someone positively. They were from difficult countries, and now they are in Canada. I think Canada is a great country. And so helping this kind of thing was fantastic accomplishment. But I think the most important thing is to be able to dialogue. I think like many of us here, John and others stressed out here, how it's important to be approachable and transparent so the families can really talk to you. I think that's the most important thing that I heard from the girls here too, the same thing.
Yeah, good. I think you answered this. How do you feel about extrophy as a means to training young neurologists?
Oh, yeah, that was another question then, no? Yeah, I really, so I answered that.
Yeah. And then this one, share with us what this award means to you.
Well, I have mixed feelings. What I'm going to say about the feeling. One mixed feeling, I know I'm getting really old because I start getting awards. That's something funny, Wow. Now I'm going to get the wheelies, and we got in Brazil now. They say, "Oh, people, you have to come. We're going to give." Wow, I know I'm almost at the end. But at the same time, I must tell you, This, for me, is the best word I had. This means, this is not political. This means recognition for your humanitarian work. I never had one. I thank
Well,
you.
it's well
It means a
deserved.
lot for me. This for me is a recognition. The biggest recognition for my work that I have is right here. Because that's why I became a doctor, because I want to help. I'm not being political, it's true. No, I really like medicine. I love what I do, and I think this is a tremendous recognition for me. Thank you so much.
Well, thank you. Dr. Shukla, I didn't know if you had a question or wanted to say a few words to Dr. Salle.
Oh,
He's got a mic for you.
No, I mean, I just think as surgeons, Dana, myself, Dr. Krieger, Dr. Lee, everyone, I won't start naming, there's a lot of surgeons in the room here, but for all of us, from parents, you've seen a humanitarian, you've seen somebody who cares a lot about extrophy, but as surgeons, we really recognize him as a genius in our field. He's sort of, we always consider him sort of a magician. He starts operating and you just don't know where this is going. And then it just sort of, suddenly it's like, wow, that turned out perfectly. And you just didn't know how this was, this journey was going to go, but it just, he's taught us so much. So I think as surgeons, our appreciation is, thank you for leading the way and making maybe the mistakes that, you've then taught to others so that we'll make our own, but hopefully in the end, the children in this room will be better for it. So I already think we're much better off because of the contributions you've made. You really transformed the field. I mean, a lot of the surgery we do, we use the Salle flap, we use the Salle technique, we do the Salle approach to the pubis, to the corpora, to the rotation. So a lot of the finer points of the surgery, a lot of that is, the gentleman right there on the stage. So thank you for all that you've done. Pippi.
Thank you.
well, thank you also, Asim, because everything that, you adopt many things that I propose, and this is also because of you guys that are open and understand and supportive of me. Thank you so much.